Mangwanani Akanaka, good morning, hello. My name is Sarah Bourdin, and I will be presenting on behalf of the MESH Consortium and SESHRE Zimbabwe on our abstract entitled Individual Level Perspectives of HIV Recent Infection Testing Among Female Sex Workers in Zimbabwe. So thank you very much for having me here this morning. I'd like to first acknowledge our co-authors, and as said, this abstract and research has been taken forward in close collaboration between SESHRE and the MESH Consortium. So firstly, what is a recent HIV test? So it basically determines whether an individual's HIV infection was recent or not. And the definition of recent depends on the kind of test that the test or testing algorithm that is used, and that can be kind of just a few months to about a year. And basically the test will say whether someone acquired the virus within that recent time frame or further back. So whether their infection is chronic or if it's in this sort of recent time frame, but it can't give a specific time range regarding when this person acquired the HIV virus. So what is the current issue, the current debate happening? It's that in 2022, so this year, the United States President's Emergency Plan for AIDS Relief, PEPFAR, released a guidance proposing recency testing to be adopted as a key component of new real-time HIV surveillance systems for resource allocation at a local level. And in response to this, the Foundation of AIDS Research, AMFAR, raised concerns regarding ethical and human rights issues relating to consent, risks of harm, inaccuracy of test results, and more. And they said that recency testing was unproven as an accurate tool for real-time surveillance, and that its use needed to be evaluated and client experiences better understood. And recently in September, the Scientific Advisory Board to PEPFAR have actually echoed AMFAR's concerns. And so AMFAR's position statement and sort of the subsequent exchange of views that took place adds to a growing literature questioning the individual level utility of recency testing. So how are we a part of this? We've had, at the MESH Consortium and SESHRE, we've kind of worked with recency testing for years and implementing it in real-time settings. And so through sharing our learnings, we aim to contribute to the debate around this individual level utility and these ethical concerns, and to understand how we can further support recency testing in real-world settings as informed by the perspectives of those being tested. So in this abstract, we reflect on previously unpublished qualitative interviews conducted with female sex workers in Zimbabwe regarding their experiences of recency testing. So between June and November 2018, we carried out in-depth interviews with 14 female sex workers as part of the recent infection testing algorithm RITA study. And they were recruited from Zimbabwe's National Sisters with a Voice sex worker program that's run by SESHRE. And this program provides a range of HIV and sexual and reproductive health services, including testing, behavioral counseling, and referral to government ART services. And just for information, the recent infection testing algorithm that we used was a recency assay combined with looking at clinical data, viral load testing, and ART metabolite testing to better provide more accurate results. And so we were looking at exploring the experiences and perspective of clinic users to assess the feasibility and utility of integrating this algorithm into routine program service delivery for female sex workers. And so the interviews took place in Bulawayo, Gweru, Karoi, and Mutare, and participants were aged 25 to 46. So what did these participants say? So the majority of them mentioned personal benefits, mainly regarding access to further information on their health. 3 participants actually saw the test as confirmatory of their infection, as the rapid HIV test that they had done had shown a sort of faint or unclear line, and the recent HIV test helped determine whether they actually had HIV. Other participants also mentioned that a recency test would provide an incentive for taking HIV medication either way. So with those long-term infected wanting to not worsen their conditions, and those with short-term results wanting to ensure their condition did not deteriorate. However, we did have participants did mention some concerns. So several women cited potential distress and harm arising from knowing their recency status. And they fear that they may become violent due to this knowledge, or feared repercussions from their partners, or just kind of general distress mentally as well. We should note, however, that it's quite hard to disentangle distress and harm caused by simply the return of a positive HIV test, or whether this distress and harm was caused by the additional recent HIV test. Additionally, in relation to consent, it was unclear whether some women fully understood the purpose of recency testing. So many thought the test could provide each person with a specific time frame of when they were infected, which, as I had said, the test isn't able to show. It only shows whether it was a recent or more chronic infection. And additionally, when asked why they took part in the study, some women were not able to provide personal reasons, instead relying on the healthcare workers' knowledge or instructions. And others reported that they participated out of a sense of duty or a greater good for the community, kind of this internal responsibilization that they had. And several women expressed pride at being a good sex worker who accepts these tests and these results, comparing themselves to what they define as bad sex workers who were irresponsible and did not accept their fate as sex workers. So this kind of sense of duty that they had. So our results do highlight several issues pertaining to individual level utility and ethical concerns, issues that were also raised by AMFAR and the Scientific Advisory Board to PEPFAR. And amidst a growing demand from patients to be active agents in their own healthcare decisions, it's essential that in moving forward with recent infection surveillance, we further explore the programmatic utility of recency testing through community engagement. And so it would be important to have a rigorous and independent evaluation of programmatic utility, use, and impact relating to HIV recent infection testing. And just to say that this we're currently just writing a commentary on these results that I've presented here in the abstract, and that will hopefully be published in the very near future. So do look out for that if you're interested in more information. And we've also got these some of these articles and reports I've just put up here, where we discuss and present our further research that we have done on recent infection testing, and you can find all of this at our website, so mesh-consortium.org.uk. Thank you very much for listening and for having me speak today, and I hope you all have a great rest of the day and enjoy the symposium. Thank you.